Welcome to the Aesthetic Angle by Monarch Plastic Surgery, Kansas City's soon-to-be #1 podcast on all things cosmetic, plastic surgery, injectable, skincare, and wellness. I'm your co-host, Dr. Keith Hodge, and I'm joined today by my colleague and partner, Dr. Kalila Steen, the queen of the dreamless tummy tucks.
Thank you. It's my pleasure to be here. Thank you for having me here, Dr. Hodge.
And our guest of honor today is Kirsten, one of our talented nurse injectors.
Nice to see you.
Well, today's topic is neuromodulators and fillers. So, again, this is a new podcast. We don't have any sponsors. But if we had a sponsor, today's obvious sponsor would be Allergan, because they provide Botox and Juvederm. So I want to start the podcast off today with a few patient testimonials to show why people love these so much. So first testimonial, she said, I wanted to look rested. After a week, when I look into the phone, my forehead is so smooth that Siri's asking me for my nurse injector's number. That's a pretty good recommendation.
I think that is a solid recommendation.
And then here's another patient testimonial about a filler. My friend asked about my lip gloss. And I said, lip gloss? Oh, no, honey, that's structural integrity. So today we're talking about smooth cheeks, smooth foreheads, and structural integrity. So, Kirsten, let's do neuromodulators first.
Yeah.
There's several in which to choose.
Yes, there is.
Everybody has their favorite. I know I have mine.
Yes.
What's your favorite neuromodulator?
I'm split. So Botox, Dysport, I'm split between the middle with them. I actually flip back and forth between my treatments. I like switching them for my own treatments because I feel like it's kind of switching up your shampoo a little bit. Mm-hmm. You know, I feel like you just kind of get a fresh feel for your treatments when you switch them. But I will say my patients are split too. So my patients are going to be very one-sided most of the time, but it's split down the middle on which one they prefer. So Botox or Dysport kind of just depends on the person and their own body.
Now, I hope you don't mind if I jump in there for a quick second.
Absolutely.
Let's catch up here. Let's go back to square one for a quick second. Tell us, what is a neuromodulator?
Good question. So a neuromodulator, our cosmetic neuromodulators are botulinum type A. It's going to be a product that essentially stops the signal between a nerve and a muscle.
So that sounds like super fancy talk.
Absolutely.
What is the nuts and bolts of that?
Essentially, it's going to make sure that your muscle contraction is relaxed enough that it's not causing wrinkles on those dynamic movements.
That's awesome. Yes. And so oftentimes we already opened the conversation by saying neuromodulators, and that might be perhaps a type of word choice that maybe not a lot of non-medical people use.
Yes.
And why is that? Like, why most people might just sort of say Botox. Tell me more about Botox.
Or Tox, yes.
And so why does that? Can you tell me a little bit more about the difference between, or compare and contrast, I guess you might say, Botox and neuromodulators?
Yeah, so, a neuromodulator is something that's going to affect the way that your nerve is communicating.
Right.
Correct.
It inhibits the acetylcholine release in the presynapse, so it doesn't get the message for the muscle to contract. That's if you want a deep dive, scientific dive.
And so Botox is going to actually be your brand of neuromodulator.
So it's a type of neuromodulator.
Exactly. So just like Coke or Pepsi is a type of soda, Botox Dysport is a brand.
Awesome.
Of neuromodulator.
Awesome. So it's all just about the brand on top of that.
Yes.
Cool. Very cool.
There are a couple others like Xeomin,
Jeuveau,
yes.
Latibo, which is the newest.
I haven't heard of that one. That's new to me. Have you found anyone that you felt like had become resistant, and that's why you changed? Do you believe it's antibody theory to Botox?
I do. I think it's very rare to have a true resistance to Botox. I have had a couple patients in the 11 years of injecting that I've seen that just have zero response. If you have somebody that is Botox brand has worked for previously, and it's just the duration is getting less for them, mm-hmm. I will often recommend that we switch to a different brand, mm-hmm. try a different brand, and 95% of the time, I would say they respond better to the different brand. Kind of like I said, switching up your shampoo, mm-hmm. right? Mm-hmm. And so I do have patients that will do specific Botox brand treatments for a long time, switch to Dysport, do those for a long time, and then just kind of switch back. So it really depends on the patient. I also have patients that, have been doing Botox brand for 20 years and it works wonders for them. And they've seen no decrease in the effectiveness for themselves. So we continue with it because why mess with a good thing?
Yeah. I'm one of those people.
Yeah.
18 years of counting.
That's awesome.
Botox
That's amazing.
only.
Yeah.
Do you see the same thing with other brands that sometimes it gets to be a little bit less effective?
Yeah, I would say that I think it really is patient dependent, but yes, I do see that vice versa with other brands as well.
Out of curiosity, if you had to take like a random guess, what percentage of your patients would you say see some sort of decrease effect after some time?
I would say maybe 5 to 8%.
So pretty low.
It's pretty low.
So for most people,
It's pretty low.
you're going to use it and it's
Yes.
going to work great for a long time.
Yes.
That's awesome.
I think one of the things people think, oh, I've been doing Botox for 18 years. I should need less units because I've been doing it for so long. Not necessarily, because when we age, we lose collagen, elastin in our skin. So any movement that our skin is making, it creases easier. So people may think it's a decrease in effectiveness, whereas they actually just need a higher dose or more units to keep that movement more relaxed for a longer period of time. So your 20-year-old patient that comes in that has the tiniest baby lines and we're more preventing those lines from getting deeper, their dose is going to be less. Their skin isn't going to crease as easy, their muscles aren't as strong. And you have somebody that's in their 50s or 60s, even if they've been doing Botox, their muscles are going to be their muscles are going to be weaker, essentially, so they're not going to be as strong, but their skin's going to crease easier. So they do oftentimes take a higher dose to get the same result as a 20-year-old.
I see. Now, out of curiosity, I've got some friends of mine, who are my age in their 30s,
Yes.
who are doing Botox and Dysport now
Yes.
with the hopes of prevention.
Yes.
And so tell me about that. What are your thoughts on that?
If you have wrinkles at rest, that is a great time to start doing Botox. If you raise up your eyebrows or furrow your brows and you're not creating wrinkles and you don't have wrinkles that are sticking around, my opinion is you really don't need to waste your money on it yet. And I'll tell patients that because they have a friend that does it and they think they need to start it just because their friend does it. They come in and they're not creating those wrinkles.
As a vein plastic surgeon, that was my theory. I started using my early 30s because I just did not want the resting wrinkles.
Yeah.
So.
And honestly, I had wrinkles that had settled in when I was in my teens. I had a deep furrow between my brows, and to the point where when I was running track, I would be frowning and concentrating so much that I would actually come away from track meets with tan lines. So me at, 27, 26, that's when I got my first Botox treatment. And it was beneficial for me. It was preventative for me because I don't have those lines anymore. But somebody that's not creating those lines, they don't need it.
Do you have any experience with Xeomin? Because what I've read is that it's the naked Botox.
Yes.
It has fewer accessory proteins,
Yes.
so less antibody risk, and maybe it's a nice switch if someone's being resistant.
Yeah, we don't carry it at Monarch. I personally have never injected it, but you are correct that it is lacking an accessory protein. From what I've heard from patients, that can be beneficial if they are feeling like Botox and Dysport or any of the other brands are not working for them any longer. Mm-hmm. I've talked to patients that Botox Dysport just really does not do anything for them, and they'll go get Xeomin and they do see some results with it. The duration is typically not very long. It's not even 3 months. And then patients that I've talked to that have had Xeomin in the past, that it's just kind of the one that they've used, mm-hmm. they often feel like their duration is less. And that's my experience. I can only speak to what I have heard from patients and not actually injecting it.
Any experience with Jeuveau?
I would not say I have.
I have anecdotal experience. I got it once. I didn't feel like it lasted as long.
Yeah. I would say, we carried it here at Monarch for about 1 or 2 months after I started, and then we stopped carrying it. So that's why I say not really, because I don't feel like I injected it enough to have actual experience in my own patients or on myself.
Any thoughts on Daxxify?
I would like to try it again. Injecting it again. We trialed it when it first came out with the expectation from the company that manufactures it that we were going to get a longer duration with it, hoping 6 to 9 months for most patients. And we did not see that on any of our models that we trialed it on. We saw maybe an extra month than they would have gotten with Botox or Dysport. But the cost was a lot higher. So they were going to be getting maybe a month longer, but for double the price.
Right.
And so that didn't seem worth it for us to bring on. But I've, since heard that they have backed off on their price a little bit.
Okay.
And so it would be worth trying.
Well, it's supposed to have a sooner onset of action too.
Yes.
And I was one of those models. I did not see that.
Okay.
And it did not last any longer for me than anything else.
Yeah.
So I cannot say Daxxify is going to last 6 months. I did not see that in my own forehead.
Yeah. I would say, speaking of quicker onset, I would say Dysport does tend to show a little sooner than Botox. Not always. I still say always give it a full 2 weeks to settle in for those final results. But most patients will say within like 2 to 3 days, they're seeing some really nice results after their initial treatment.
Okay. Dr. Steen, anything else you want to discuss about neuromodulators?
I think that's about all I can think of.
Yeah. Only thing I would say is that we should discuss where you place it, because there are indications.
Yeah, that's a great
there are
match.
indications for it, and I find that we probably use just as many units
Oh, yeah.
in the non-indicated areas. So
Absolutely,
let's start with
yeah.
indicated areas first. Where are you typically placing Botox?
So between the brows, the glabella area, forehead, crow's feet. But we do a lot of off-label areas with Botox and Dysport. My favorite being in the lower face. We have muscles that work in all of our lower face, and a lot of people hold stress and tension in their lower face that we can relax with Botox, which not only helps, lift or for those fine lines and wrinkles, but also I've seen some improvement in doing the masseters for teeth clenching. Myself, I do my trapezius muscles because that's where I hold all my tension, and I have found some significant relief.
That's amazing.
What's the typical unit dose
30 units of Botox in the trapezius.
per side?
Actually, total.
Oh, total.
15 per side.
Wow.
Yeah.
That's not that much, really.
It's really not that much.
As large of a muscle as that is.
Yeah. Considering the masseters are typically about 40 units, so 20 per side, you would think the trapezius would take quite a bit more, but it seems to do a great job with the 30 unit dose.
Well, I don't know about how many trapezius muscles you treat, but I know we treat a lot of TMJ, and you get great results with that.
Yes. And not only can you get relief from the teeth clenching and the pain and headaches, but also for somebody that is pretty bulky in that masseter area, we can see a really nice slimming effect,
Right.
which for some people is the reason why they're doing it. And for some people, it's just an added bonus.
I injected for 17 years, and I haven't injected for a while, so I'm surely not totally up to date. But another place I like it is the DAO.
Yes.
So
Yes.
for the corner of the mouth.
Yes. Kind of in that lower part of the face. That's where I do see a lot of people holding tension. And yes, it really can have some great lifting.
Help
And
the
I've seen that.
RBF.
Yeah, help the RBF.
Yeah,
Nobody likes RBF.
The win, yeah.
And also
Yes.
the POTA orange changes in the chin.
Yes.
I love it for that.
Absolutely. Yep. I need mine. My daughter told me that she wanted her chin to be spotted like mine. So I took that as a consideration that my Botox in my chin is wearing off.
What about platysmal banding? What are your thoughts on that?
I love it for that. For the right patient, you may have a patient that comes in that doesn't have a strong pull in their neck, but when you have somebody make what I like to call the eek face, and they do get a downward pull, you can really see some nice results in the platysmal banding and actually some little bit of jawline definition for the right patient.
What's the typical dosing? What's your range of dosing for platysmal banding, do you think?
Oh, it really depends. I would say anywhere between 10 to 20 units is pretty standard.
My favorite treatment for platysmal banding is a platysmoplasty, but nobody's ready for that.
Shameless plug.
Well, I mean, you got to take them where you can get them. But that's going to be long term.
Yeah.
Right? With Botox, it lasts 3 to 4 months and you're back to where you started.
Yeah. Any other places you can think of? I can think of one more place.
I can think of one more place too. Underarms.
Yes. Love
Underarms
Botox.
for sweating.
No shame in my game.
Also, the hands are an area that
yeah.
a lot of people don't think about sweating. In the hands, it will help decrease sweating in the hands and the underarms.
The cool thing about underarms, it'll last 6 or 7 months.
Oh, yeah.
So it's just twice a year.
Yeah,
That's awesome.
absolutely.
I think we covered neuromodulators.
Yeah.
Let's move on to fillers. Lots to talk about in fillers. I remember when I first started, I didn't realize it, but Botox became available in 2002. I was still a plastic surgery resident. I was learning how to use Botox. And then I believe it was 2003 was Restylane. So when I started my practice, that's all we had, 2 products.
It's come a long way.
Juvederm came out in 2006.
Yeah.
And so now we probably have, 20 plus fillers to choose from. There's one
yeah.
every day.
Yeah.
Endless.
It is. I know. There's more and more coming out every year, too.
So maybe we just talk about categories.
Sure.
Hyaluronic acid is probably the most popular.
The most popular, the number one, for sure.
Calcium hydroxyapatite. PLA, which is poly-L-lactic acid.
Yep. Also known as Sculptra.
Sculptra.
Yep.
PMMA, polymethyl methacrylate,
Yep. Belafil.
Belafil.
Yes.
Autologous fat, I love that. And now the new killer block is Aloclay, which we're just now starting to use. So let's start with HA because it's probably the most popular, right? I mean,
For sure.
Okay.
Yeah. It's the one that I do the most.
Yeah. So when you have a patient in front of you, do you go by what they want to accomplish? You look at their age. I mean, what helps you start the process of determining which filler am I going to choose from? Because I have so many options.
Right. Well, I mean, I think the first thing that I'm doing in a consultation, besides getting to know the patient, is really what their expectations and their hope is. Because I could think that they need one thing, but if that's not going to address their concerns, then I'm not going to make them happy. So I start by what is your main concern and what's your goal for this treatment? And then let's build on that. So if I determine that somebody's best results are going to be with a filler, it's really going to be what filler I choose for them is going to be dependent on a multitude of factors. What are the results that we're looking for? How much lift are we looking for? Is it in an area that when you smile or you talk, we really need to choose a filler that's going to have a good elasticity, that is going to move with you? But I think the biggest thing is I want my patients to be happy and have their expectations met with the treatment. And then also, it has to look natural. It has to look natural because if it doesn't look natural, what's the point?
I love you say that because, people talk about, I don't want any filler. It all looks fake. And go, that's the bad filler. The good filler you don't notice.
Yeah.
It was good filler.
Yeah. You're like, it's the people that are walking around with filler that you're like, I just want to look like you. And you're like, well, they've got filler and you don't even know it.
Right.
It's the people that you walk around and you're like, oh, she's got too much lip filler. That you're like, that's not good filler.
People often ask me in my clinic how to choose a nurse injector. And because once again, they don't want to be overdone. They don't want to have too much.
Yes.
And I say, well, if you look at your nurse injector and you think they look good, this is probably a pretty good
That's
indicator.
a good place to start.
Yeah.
And I do have
Gorgeous.
filler and Botox, so.
And all of our nurse injectors look very
All of our nurse
natural.
injectors
Yes.
are gorgeous.
Yes.
Yes,
They all are.
very natural.
All shows excellent taste and a natural conservative outlook.
Absolutely. Yeah.
Very young.
Well, that's Botox and filler talking.
Let's walk through the Juvederm family real quick.
Sure.
Because that's probably the easy way to start.
Sure.
And do you want to just talk about all the V's of Juvederm?
Oh, yes. We've got a lot of these.
Well, do you mind if I ask you for a quick second? You mentioned earlier that the HA or the hyaluronic group of fillers
Yes.
is your most favorite, most common.
Yes.
And so tell me just a little bit for a moment about that HA group of fillers.
Yes.
Why is that your favorite? Why do you find yourself going to that so much?
Because I think when patients come in, they're really looking for volume restoration, whether they know it or not. You know, they want to look refreshed, and to be able to do that, we need to put volume where you've lost it. So HA fillers are going to give you a result that's instantaneous. You get to see it immediately, which is, you know, we live in the instant gratification world right now. I mean, if I can Amazon a package to my house by 10 o'clock tonight, I'm going to do it, right? So people like that. You know, patients really do love the instant gratification of the filler, the HA filler. I love Sculptra, and it is amazing, but that is a filler that takes longer to see your results. And for the right person, that's perfect. But the HA fillers are something that we use very often, every single day when I'm seeing patients, because it's going to give somebody instant gratification, and it's going to address the volume loss that people have seen.
And what age do you think would be a good time in life for people to generally start thinking about fillers?
I think it's really patient dependent. I would say the 30s is usually where I start to see patients, but I do have some younger patients in their 20s that are more looking for like lip filler, a little bit of extra volume in the lips. So it really just kind of depends on the area and the concern.
And I know we talked a moment ago about Botox and its locations.
Yes.
Mostly upper face, also some lower face applications.
Yes.
Tell me, where do you find you're doing a lot of filler in the face?
A multitude of areas. You know, I think the most common is lip filler. That's what, you know, a lot of people are just wanting a little extra on their lips. So that's where I tend to see the most popular area if I had to choose one. But areas like the temples, we lose a lot of volume in our temples as we age. And moving down the mid face is a huge area where I just see so much volume loss, and we can add some volume back in that area. It looks very natural, and it just gives somebody that refreshed look that they're really going for. And then we move down into like jawline, adding some jawline definition, into the chin for a little projection, or into the chin shadows where we lose volume as well. We also have fillers that can target like perioral lines, so kind of what people call the lipstick lines or the smoker's lines, the smile lines. There's just, you know, there's so many areas of the face, but also, you know, we have the neck that we can treat, and we can also do the hands. The hands are an area where people don't realize they lose volume, and restoring some of that volume in the hands, they're like, wow, now my hands match my face.
Yeah, definitely an underutilized area.
For sure.
And so that's great. So there's so many different applications for fillers.
Yes.
One question I get asked in the same vein as I don't want to look too unnatural.
Right.
One question I get asked is, well, what if I don't like my filler? What if too much got put in, or I don't like something about it? Can you do something to reverse those hyaluronic
Yes.
Fillers?
Yes. And that's what I love about them, is that you can reverse them or dissolve them. So we have an enzyme called hyaluronidase, and it breaks down the bonds of hyaluronic acid filler, and immediately upon injecting it, you're going to have that filler start to dissolve, and then your body just, you know, processes that and eliminates that. But that's what I love about it, is if you are seeing something that the patient just isn't liking, or I'm not liking, or we have a complication, you know, we can dissolve it and we can reverse it, which is
great peace of mind.
Yes, yeah. Extremely important to me as an injector, and I always make sure all my patients know that going into those treatments.
Yeah, it's great. Safety first, after all.
Absolutely.
Which are the fillers that you can't dissolve?
The Radiesse, which is the calcium hydroxyapatite.
Yep.
And then Bellafill, which is the PMMA. Sculptra, you know, you can't dissolve it, but it's more stimulating collagen. So it's more of a biostimulator instead of like a filler, you know, so there's really not a need to be dissolving Sculptra. But as far as Bellafill and Radiesse, I would say that's high up on my list of why we don't inject those or carry those at Monarch. I want to be able to reverse a filler if there's a complication or an undesired result.
And speaking of which, we probably should have mentioned this a little bit earlier. Sorry for backtracking for a quick second.
Okay.
But since we're on the topic of reversing fillers, tell me if what would happen if someone didn't like their Botox result? Kind of tell me a little bit more about that.
So, this is why I call myself a conservative injector, a less is more injector, is because if we have a relaxation of the muscle with Botox or Dysport, we're allowing time to pass to have that Botox or Dysport wear off. So, for example, one of the risks of Botox or Dysport is going to be, having a heavy eyebrow or a heavy eyelid. First of all, we take all precautions to make sure that that is not going to happen, making sure it's in the right muscle, the right dose, the right patient. So prevention is always key with that. But if for some reason somebody did have that, we're allowing time to pass. It is a temporary effect. So 3 to 4 months later, it's an annoying 3 to 4 months because you got to allow that to wear off. But I do think that that's one of the reasons why you go to an experienced injector who is up to date on, their anatomy and being conservative, and just making sure that we're not doing too much at one time.
Mm-hmm. I think the great thing about Botox is that, first of all, I think that having a little bit of a droopy eyelid, first of all, I think happens very rarely, especially in the hands of an experienced injector, which is an important reason to seek a good experienced injector. But really outside of that, complications are almost non-existent for Botox in the face. And so that's one of the things I love about Botox is that it's almost complication free. Is that a little too forward of a statement to make?
I don't think so. I think the definition of complication is
maybe
important.
A surgeon's definition of complication.
Well, yeah. I mean, but I think a patient's definition of complication could be different than like my definition. I mean, I would say in all my career of injecting in 11 years, I would maybe say that I've had like less than a handful of true complications. But, I have had patients that, are upset about a little tiny bruise. And that's something I always make sure my patients know is,
right.
Bruising is normal. But I wouldn't consider that a complication. I'd consider that a normal side effect.
Right.
Of course, we try to minimize that as much as possible, but I wouldn't consider that a complication.
Yeah, this is one of the things I love about Botox is that it's basically set it, forget it. Yeah. And almost everyone is very happy on their way out the door.
Yes, absolutely. Yeah.
It's become safer because when I first injected, it was more dilute. You get more spread. I had a couple of droopy eyelids.
Oh, is that right?
I have to do the over-the-counter Opcon A to stimulate the smooth muscle to help the eyelid elevate.
Yes.
But now that it's more concentrated, we have little spread. So I don't think that's as common anymore.
Yeah. Well, and I think that's what I also love about our ability to... So... to back up a little bit, Botox and Dysport come as a powder, right? Mm-hmm. We have to add liquid to it to be able to inject it. We call that reconstituting. So, patients will come in, my injector diluted their Botox. And it's like, well, they didn't dilute it. You have to add. Mm-hmm. You have to add liquid into it. But I know what they're saying. But really, as an injector, one of the things that I love to do is there's some areas that could use a little bit of a spread. Our forehead muscle, right. You can spread that Botox throughout the area or that Dysport throughout the area, and you're not getting, you're not risking having some of those, dropped eyebrow, dropped eyelid, but then in some of the areas where between the brow, we don't want it to spread as much, or like down in the lower face, you don't want it to spread as much. We can tighten that reconstitution a little bit or that dilution, and we can actually have less spread of the product. So that's one of the things over the years as an injector that I've really learned is really you can tailor this to the muscles, to the patient, and the result that you're wanting, which is exciting, and I get excited about that.
Yeah, it's really great.
It's really fun.
So that will have 5 different dilutions on your table?
Maybe.
Well, it's just interesting to hear what an artistic approach can really be brought to it.
Yeah. I think, I think that's why I love what I do so much, is because you have the science aspect of it, the medical aspect of it, and then you have the artistic aspect of it. And I'm sure you guys feel that way.
Sure.
As surgeons too, right? I mean, you have where they say where science meets beauty, and it's just one of those things where you do get both of those, and it is fun. You feel like that's the artistic.
And that's just even, dipping the toe into the Botox realm, let alone fillers.
Right.
Which is truly artistic.
Yes.
So back to the Juvederm family.
Yes. Mm-hmm.
There are 3 main.
Yes. And these are the ones, there are different ones, but the ones that I use the most, or I would say we carry. At Monarch, we have Voluma, Velour, Volbella, and that's in the Juvederm family. They also have a skin booster called Skin Vive, and that one is going to be more of like a skin hydrator. In the filler family, not quite a filler.
Okay. All right. So when you're choosing between those three, is it based on location or more patient age or just desired outcome?
Both. Yeah, all of the above.
Okay.
The fillers, we have something called rheology, which is, essentially describing the different properties of a filler. So fillers have different viscosities, which is like how thick it is. We have different cohesivity, which how well does that filler hold together, and then elasticity, which is going to be that stretch of the filler, and then also we have G prime, which is going to be how well that filler lifts. So based on all the different properties of those fillers, that's typically why I'm choosing a specific filler for a patient, instead of just tossing something in there and hoping it looks good.
I always love that G prime term.
G-prime.
This is always level 5.
Yeah.
Another G double prime too.
Yeah.
So, but also longevity, right? The different.
Correct.
They have different longevity.
Yes.
So.
Yes. And I think that also can come down to the different areas of the face that you're injecting it. If you're injecting filler into an area that you're talking and you're moving those muscles quite a bit, it's going to break down a little bit faster, and that's normal.
So for Volbella,
Yes.
what's the typical application?
I would say lips and then very, very fine lines. For lips, it's going to give us hydration and definition. It's not going to give us a ton of volume, which is perfect for the right patient.
Is that structural integrity?
I'd say so.
Okay, so what about velour?
Velour is going to be a little bit thicker than Volbella. It's great for smile lines, kind of some of the little marionette lines, chin shadows. It's great in the lips for somebody that wants a little more volume.
Okay.
Yeah.
So you use lips sometimes.
Yeah, that might be off-label.
More dramatic, a little more dramatic look of the
A
lips.
little more dramatic look, yeah.
Yeah.
Yeah, but still natural.
Yeah. And then Voluma?
Voluma is going to be primarily the cheeks, the chin. I use it in the jawline. So anywhere where we really want structure and contour.
What about temples?
Temples for sure, yep.
Okay. And then Restylane has its own little family of
Yes.
fillers.
Yes, they do, and I love it.
So what I have is lift, kiss, contour,
Yes.
refine, define. So,
Yes. We also have, we call it traditional or regular Restylane. They also have eyelight, which is, essentially regular Restylane, but in a half syringe,
Okay.
indicated for under eyes.
Oh, okay. Is that your go-to for under eyes?
No. I don't love filler under the eyes. Maybe for the perfect candidate, but not many people are the perfect candidate for under eye filler. I try my best not to do under eye filler. It's just...
My favorite under eye filler is autologous fat.
Yeah. Yeah. So I'm just going to refer them to I love PRF under the eyes. That would be probably my favorite thing, which is just briefly, we draw your blood, spin it down, re-inject the white blood cells and platelets up under the eyes to stimulate collagen and elastin growth. Love it because it's 100% natural. So
What does PRF stand for?
Platelet-rich fibrin.
Nice.
Thanks for testing me on that today.
A plus. But as far as like lift, where would you put lift?
Lift is similar to Voluma, and so that's going to go in the cheeks,
Deeper
temples.
areas.
Yes, absolutely, more for the contour and structure.
I think kiss is probably pretty obvious.
Kiss, it's in the lips. Yeah, you got it.
Contour?
Contour is for this actually like squishy, fatty part of the cheek.
okay.
Beautiful in the area. That's actually what I have in the front part of my cheeks. I love it because it can go a little bit more superficial, but it really, the elasticity of it is amazing. So when you do talk or smile, it's not just staying in one place. You actually get a really nice, beautiful volume in that area without it looking like you have filler.
So I've never injected that product. I mean, I stopped before that came out. So I was reading about that.
Yes.
And then what I learned was Restylane has HA NASHA, non-animal stabilized hyaluronic acid. They have Express HA,
Yes.
which was more mobile. Is that
Yeah, so I just like to think of it in areas that you're expressing. You know, you're talking and you're moving and you're smiling and you want that filler to really,
Move.
stretch. Yes, move. Yes, exactly.
with the expressions.
So, yes. So then I also will use contour sometimes for a nice pillowy soft lip. I'll use it down in like the chin shadow sometimes. So
Okay.
yeah.
Anything else about HAs you want to talk about?
We also have Versa. That's a line. It's
Okay.
by Revanesse. You can use it in all different areas, so that's an option as well. So, I have my favorite areas to kind of use that in as well, but it's another HA filler, just a different brand.
Where would you use it?
Lips, smile lines, marionette lines. It's a beautiful filler.
More dynamic areas.
Yes.
Does it have any advantage on longevity or anything? Or
I would say with Versa, I have some patients that do metabolize their filler very, very fast. They come in and just something about their metabolism, 3 to 6 months later, their filler is gone. And I would say Versa is probably my choice for those patients because they do tend to get longer for whatever reason with that specific filler.
I know we just listed off about 2 dozen.
I know. I think we actually carry 12 different fillers.
Oh, wow.
In the, Juvederm, Restylane, and Revanesse.
How
profile.
long do you generally expect to get out of your fillers? How much time do you roughly get?
Yeah, I think that's really going to be patient dependent. I would expect most patients to get at least 9 to 12 months, up to 2 years with some of the cheek fillers. I will say, I tend to see a lot longer duration with fillers than the manufacturer will say that people will get. So, my lip filler lasted me 3 years and I didn't touch it and it was mostly gone when I just redid it.
Well, that's a pretty good bang for your buck right there.
I think so.
Yeah.
I mean, not everybody's going to get that. And I think it's really dependent on the metabolism, but I also think that that's where a lot of patients tend to get overfilled because you have a patient feeling like their filler is gone. They don't know they don't remember what they looked like 3 years ago. They come in and they are saying, hey, I want more filler it's been 3 years. As an injector, I'm putting my hands like on the lips and feeling because I can feel when there's still filler there. And I will be the first person to say no. Like you still have filler there. We do not need filler there. Because I think that's where a lot of patients get overfilled is putting new filler on top of old filler.
Right.
And then you just end up with too much and they kind of lose sight of what they used to look like.
I've heard some patients be concerned telling me that they think that the filler never dissolves. Do you think that
I don't think that's true. I do think with hyaluronic acid fillers, our body is going to dissolve it eventually. But I do also,
too.
Yeah. Our body has a level of actually hyaluronidase, the enzyme that dissolves it. And so it will eventually dissolve, but I do think that it could be, even up to 10 years that it does stay in our body, which is why it's important that we go to an injector that, is experienced, is placing it in the right level, and making sure that it's just done properly.
And so I'd like to ask you, would you mind, if you wouldn't mind sharing?
Absolutely, yeah.
Can you tell us what's in your face right now?
Yeah, good question. Okay, so I have my last treatment I did with Dysport, and I did between my brows, my forehead, around my eyes, my chin. I did a lip flip with Dysport, and my DAOs. And
how frequently would you recommend getting that done roughly?
3 to 4 months is average. I'm about 4 months out from my treatment and getting close to being due. And then I also have filler into my cheek areas, down into the little chin shadows, and then a little tiny bit in my lips.
Lovely. Dr. Hodge?
I'm full of Botox, forehead, crow's feet, underarm. I've had Sculptra in the past. It's probably been 3 or 4 years. I could use some more Sculptra because it is something that needs to be maintained once a year. And so is it usually 2 to 3?
I like to say once you've done a Sculptra treatment, you should maintain with 1 maintenance vial per year.
But the initial treatment, though, is it 3 sessions?
Yes, 2 sessions.
1 to 2 vials per session,
Yes.
depending on how much volume you need.
Yes.
Then yearly maintenance. So.
Yes. And I've also had Sculptra. I should say that too. Just within the last 4 months.
I think Sculptra is amazing for global facial rejuvenation.
Yes, me too.
And that is not an HA. That's the PLLA. And like you said, well, you describe it. I mean, you tell us.
Yeah.
How do you describe Sculptra?
It's a collagen stimulator. So great for areas where we're just wanting to replace a little bit of volume. Like you said, a global approach because we can treat large areas. It also is wonderful to give this kind of just something that I like is it gives this glow to the skin. It's like the Sculptra glow. Within a month after getting it, you're like, man, my skin quality is better. So I do love it for weight loss patients. I do see them getting great results with Sculptra, and that's usually our go-to.
Yeah. So we've covered HA. I would just say from a historical perspective, the calcium hydroxyapatite, I liked it at first because when it came out, it was a longer acting. But I only injected it deeply because I knew you couldn't dissolve it. And so that made me a little nervous. I would not use that today. I think there's better options today. I like Sculptra. I'm a fan of Sculptra. I would not use Belafil because you can't dissolve it. And like you said, it's at least 5 years. And there's MRI studies now showing a lot of these fillers hang around for 4 or 5 years, even though you can't notice it or really even palpate it. It's there when you look in the soft tissues. So what's left besides the fat? We covered everything else? I think so.
I think so,
yeah.
So Dr. Steen, I mean, what are your thoughts on autologous fat?
Well, I love autologous fat. I think that fillers are an amazing option. And oftentimes I see patients who have never had anything done, Botox, fillers, any facial surgery, and they kind of want to step their toe into the pond, so to speak. And I always direct people first down the hall to our wonderful nurse injector side, and oftentimes sort of ask people to think for a little bit and go grab some filler, go grab some Botox. And if you like the way this looks, let me tell you, I've got something else for you. And I think autologous fat is an amazing option. It's got a lot of the same benefits of fillers, except that, first of all, it's a permanent option. It's your own fat. You can harvest it from someplace fun, like your belly or your thighs, or someplace where you don't want it to be, and put it someplace better into your face, in the spots where we would be traditionally putting those types of fillers. The other thing I love about the fillers is that they've got these magic stem cells in them that are just amazing. And so in addition to providing great volume, they also really do rejuvenate the quality of the skin because of the stem cells that are in it. And so it's just an amazing, amazing option. I think it's great to do in particular with facelifts. I think that that's the best option really, to pair autologous fat with facelifts at the time. What do you think? What are your thoughts on that, Dr. Hodge?
Yeah, I love doing volume restoration with a facelift because if you're old enough to need a facelift, most likely you have volume loss. And I tell people it's really the icing on the cake. I mean, I can pull your skin tighter. I can work on the SMAS. I can work on the platysma. But if you don't add volume, your results are suboptimal. And I agree with you. I like to take it from somewhere you don't want it or don't need it. And we collect it sterilely. We process it. We wash it. It's pure. And then we're injecting through a tiny little needle, or cannula rather, and we can put it in the temples. We can put it in the upper eyelids, lower eyelids, cheeks, lips, nasolabial folds, the prejowl sulcus area. I mean, so it's great, and the results are natural. I think the downsides are that you never get 100% take, and so you tend to have to overfill. There's always a risk of uneven uptake, but you always have more fat available. So.
Yeah, that's true.
There's always more fat someplace.
Yeah, we can find it.
So I think it's great for facial restoration. Like you said, it's permanent. I tell my patients after a month, what's there is there. You've developed that capillary ingrowth. That fat is alive and well, and it's going to just age with you. We also put fat other places like breast for contouring breast after reconstruction or even cosmetic cases. And of course, we're putting in the back sides for bigger buttocks. But I love it in the face.
Mm-hmm. Yeah, no, the fat has great applications. It's really quite incredible, actually, all the applications that we have found for fat over the years. And it's kind of ironic, because everyone's always like, no one wants this extra fat. What am I going to do with it? And it turns out it's got all these magical properties to it that if you put it someplace else is actually really useful.
That's amazing. I know I've had patients be like, oh, why can't they just take the fat from my butt and put it in my face? I'm like, well, they can. Yeah. I just got to go see one of our surgeons. I can't do that, but you can.
Yeah. And now if someone's extremely thin, we do have alloplay as an option, not for the face, but for body. So hip dips.
Although I think that's coming down the line, applications for the face.
Yes, it'll be a different version, and some should have a different name, but alloplay is for breast and body. So wrinkling of implants, better cleavage, hip dips, that's the primary place we're using that. And the benefit is you don't have to have liposuction, so there's no downtime. You just walk in, get the extra volume, you walk out, and it's permanent.
Yeah, you could even do that awake underneath local anesthesia in clinic. You don't necessarily even have to go to the operating room if you're using the donor alloclay.
Right, that's great. Yeah.
Yeah, that's amazing.
Okay, well, I think we covered neuromodulators and all the fillers.
Yeah.
I think we have an option for everyone.
So, we do. Yes.
There's no reason to age gracefully.
Oh, yeah. Yeah. Whatever that means for you.
So I think with that, we'll wrap it up. Thank you for watching. We'll see you next time on The Aesthetic Angle.